Inadequate immobilization after a bone fracture is likely to result in option is lipping, pannus, pseudoarthrosis, Hibbard's nose. Right answer is pseudoarthrosis. Bone healing following fracture occurs in distinct stages. In the first stage, blood at the fracture site coagulates and a fibrin meshwork or procallus is elaborated. This meshwork becomes coated with fibroblast, cartilage, and bone matrix, resulting in fibrocartilaginous callus formation. With time, the fibrocartilaginous callus is resorbed and an osseous callus is laid down. The new bone is then remodeled along stress lines. The healing process requires adequate immobilization to reach completion. If the bone is moved during repair, the osseous callus may fail to form, leaving a fibrocartilaginous callus at the fracture site. This callus is flexible and appear to have a false joint or pseudoarthrosis. Anoxia most seriously and immediately affects the brain and the lung, liver, spleen, and heart. Right answer is heart. Tissues vary in their resistance to anoxic injury. The most sensitive cell in the body are neurons. Irreversible damage result to brain or spinal cord if oxygen supply is cut off for just a minute. The heart is also very sensitive due to its rapid rate of metabolism. It has virtually no glycogen storage and therefore it cannot maintain anaerobic metabolism. Other organs such as lung, liver, spleen and kidney resist irreversible anoxic damage for longer periods. So right answer is heart. Which of the following is the lymphoid cell type probably responsible for initial immune recognition of an antigen? Option is neutrophil, plasma cells, B lymphocytes and T lymphocytes. Right answer is T lymphocytes. T cells perform many functions. They have receptors which binds antigen when the antigen is properly presented in association with HLA antigen on the surface of macrophages. These receptors have not been fully characterized, but they are believed to have a domain similar to the variable domain on the heavy chain of immunoglobulin molecules. Once antigen recognition has occurred, the T cell secretes factors called lymphokines, which stimulates the proliferation of B cells. So right answer is T lymphocytes. The most reliable gaseous sterilizing agent available for dental instrument is formaldehyde, ethylene oxide, carbon dioxide, hydrogen sulfide. Right answer is ethylene oxide. Ethylene oxide is a flammable gas which is mixed with carbon dioxide. The ethylene glycol is the active ingredient in the mixture which is used for sterilization of instruments which cannot tolerate dry heat or autoclaving. Immersion of instruments in cold disinfectants for 30 minutes is expected to destroy Streptococci, hepatitis B virus, bacterial spores, staphylococci. Correct option is Streptococci and staphylococci. Heat is most effective disinfectant. It can kill all bacteria, virus, fungi and spores. Unfortunately, many materials and equipments cannot tolerate heat, so they are disinfected by cold disinfectant. These are acids, alkaloids, aldehydes, oxidants and surfactants. These cold disinfectants are quite effective against streptococci and the staphylococci. Hepatitis B needs boiling water for 20 minutes and spores may need even more timing. So correct option is streptococci and staphylococci.